Hi everyone, we'll go ahead and get started now for our annual open enrollment meeting. Thank you for joining us. Hope you guys are enjoying the lunch. And for those of you on the call, I think you guys are muted, but I want to confirm, make sure the audio is okay. Can you guys hear me? Okay, and I'm gonna unmute you guys really quick just to confirm. Can you guys hear me okay?
Yes.
Calling you guys out. Esther, Ivan, can you guys hear me okay?
Yes.
Okay, perfect. All right, I'm putting you guys back on mute now. All right, we'll go ahead and get started. So thank you again for joining us. I'm going to hand it over to Christy Goulard from ABD. She is our broker. Christy, you will actually see people video chat over here, but it's okay. We can turn it off after a while if it gets a little distracting. So let's go ahead and get started.
Hey everyone, my name is Christy Goulard. I'm from ABD and we are your employee benefits broker. We work closely with Tam and Matt in administering the company's benefits and helping with the renewal process. So that's what brings us here today, is to talk about the 2018 open enrollment and the options that are now available. Let's see, down. Okay. Perfect. Oops.
Are we recording this for people who
Yeah. Okay, so what we're going to talk about, basically the open enrollment details, give a quick overview of the benefits program, and then we can just open it up for any Q&A that comes up. Open enrollment details. So as you know, open enrollment started today, and it will remain open for 2 weeks, ending end of business day, November 20th. That's 2 weeks from today. What do you need to do other than being aware of this 2-week opportunity? If you're going to enroll in for the first time or make changes to your existing medical, dental, or vision coverage, you'll want to make an active change to your benefits by completing an enrollment form and handing that in to Tam before the 20th. If you're not going to make any changes to your medical, dental, or vision coverage, meaning changes being adding moving dependents, switching from one medical plan to another, coming off a plan entirely, then there's nothing that you need to do if you don't plan on making any changes. However, the one thing that you will have to make an active enrollment, whether you're enrolled in it this year or not, is your flexible spending account. So that starts new plan year January 1st, 2019. If you wish to enroll in that for the 2019 calendar year, then you absolutely need to make an enrollment, whether you're enrolled in it currently for 2018 or not. Okay, is that clear? Perfect. And as I mentioned, you just want to make sure that those elections are submitted to TAM by end of day, November 20th. The footnote below just notes that the medical and dental benefit elections will take effect December 1st. So they're on a what we call a 12-1 plan year. That means December 1st, 2018 through November 30th, 2019. While your vision and FSA or flexible spending account benefit elections will take effect January 1st. Okay. And if you happen to miss the open enrollment these 2 weeks, what are your options? The only time you can make any changes is if you experience a qualifying life event, such as the ones posted here. So an adoption, marriage, birth, any changes in your eligibility. So if for some reason you're on a spouse's coverage and that coverage ends, whether they leave the company or whatnot, that would be considered a qualifying life event that would allow you to have your own open enrollment where you have 30 days from the date of that qualifying life event to make any changes, okay? Again, only if one of these qualifying life events occur will you be able to make those changes outside of this 2-week period. Otherwise, 2-week period now is the only opportunity to make those changes. Next opportunity will be a year from now, okay? Benefits program overview. Same benefit carriers, Kaiser and Blue Shield of California as the medical. Your dental coverage is through MetLife. Vision will also continue through VSP. Unum is the carrier for your basic life and AD&D, your voluntary life, your short and long-term disability. And then, as I mentioned, your healthcare FSA is actually administered by ADP through WageWorks. Okay, so that's both healthcare and dependent care FSA. What is changing in 2018, 2019? As you probably all know, every year we take a look at the benefits program and we take a look at the costs. 9.99 times out of 10, there will be a premium increase, okay, which means there's that slight chance that you'll have to pay a little more for the premiums each month. Nice thing is, Active Video had made a decision to keep the remaining contributions at 5% for employees, meaning 5% would be paid by you on a pre-tax basis, and then 25% for dependents would be paid by you. So regardless of that increase that we saw for this year, Active Video is keeping those contributions the same. Slight mandated changes, meaning the Department of Insurance through California has made some mandatory changes to both the Blue Shield HMO and PPO plans. As you can see on the HMO plan, the plans will stay the same. They're going to stay the same in terms of the naming convention of the plans. However, the HMO is going to see a decrease in the out-of-pocket maximum from what it is now currently at $1,750 for an individual, down $400 to $1,350. Think of this out-of-pocket max as your safety net. So if you pay out-of-pocket $1,350 within a plan year, it's at that point that Blue Shield will pay 100% for all network care considered medically necessary. Okay, so that's a nice decrease. You don't have to go up to $1,750. It's going to be $1,350. The PPO plan, however, is going to see an increase from $2,500 to $3,300 for individuals. Okay, so that safety net goes up about $800. Kaiser HMO, that also will be decreasing from $4,000 down to $3,000. So you'll see a nice $1,000 difference there. Okay. Are there any questions about these changes?
That's a 33% increase for the PPO plan.
For a PPO plan, yeah, yeah. So it's, it's interesting, to see what could be causing that. Again, it's a mandated change by not Blue Shield too, but it's kind of a Department of Insurance thing, and they're probably, my guess would be, is that they're trying to drive more people to HMO care through like a gatekeeper primary care physician. So now for the dental and vision, absolutely zero changes. Also, no changes to your current coverages under Unum. The healthcare FSA, the current IRS maximum is $2,650. That's the most that you can contribute in that calendar year. The IRS has yet to confirm if that will increase for 2019. It was around this time last year that they made that confirmation to increase it by $50. We haven't heard yet from them, but our compliance attorney has confirmed, hasn't confirmed, but he projects that it'll probably go up another $50 to $2,700 for 2019. So keep your eye on that, especially if you're currently contributing and you want to continue your FS.
sorry, Emmett's mute, sorry.
I'll repeat that. So 401k, the annual contributions will be increasing to $19,000 for 2019. And just a reminder, you can change your 401k contributions pretty much at any time. You don't have to wait for the annual open enrollment period. Here's a quick snapshot of your 2018-2019 medical benefits. You can see on the two left columns, Kaiser, Blue Shield, HMO. The new out-of-pocket maximums are at the lower amounts, $3,000 for individual on Kaiser, $1,350 for Blue Shield. Everything else will remain the same, okay? Now, these are just high-level benefits. We'll have, or I believe that we do have the actual full benefit summaries on your benefits portal. So I know that Tam had provided the link to that. You can see that. You can also do cross comparisons too from last year's to this year's plans, or I should say this current plan year's plans to next year's plans. Blue Shield PPO in the far right column, you can see, actually the out-of-pocket it's $3,300. It was $2,500. You can see that that changed. Everything else is remaining the same.
Does having a baby fall under inpatient hospital?
Yes, it does. No changes to dental and vision benefits, but I just wanted to provide that quick little snapshot so you can see. One little thing I like to note about the dental benefits, these are really rich, actually. I rarely see an annual maximum that goes above $1,500. So the fact that the network coverage for the dental out-of-pocket or annual maximum is $2,000, that's really rich for this plan. Dental is a little different than medical in that once you hit that medical limit, that maximum, then that's the most that MetLife will pay for the year per person. Okay, so you just want to keep that in mind. It's not like the safety net that you see in medical, okay? Another thing that you'll want to note about dental is when you contact your dental provider, your dentist's office, rather than saying, do you take MetLife? Everybody's going to take MetLife. And when I say that, they take MetLife, but they may not be contracted, okay? Which means you would fall into that second category, non-network. You can see that your out-of-pocket costs would be higher in that the coverage for basic, if you were to go in for a filling, they're only going to pay 80% of what's considered usual and customary, okay? 50% for anything major. So if you needed a crown versus a 60% major on the in-network, those can really add up fast. So that's something you'll want to take into account when you contact your doctor, your dentist. Rather than asking, do you take, maybe use the terminology, do you contract with MetLife? Okay, that's a huge differentiator. BSP Vision, all the same. Go ahead.
Is there a way to check? Is there like a MetLife website? Go
There
the
is.
other way and just look
Yeah.
up your own doctor. That
Exactly.
way you don't have to rely on what they're saying.
Exactly. So, and actually that's a good practice to get into because a lot of times dental providers, they may not communicate to MetLife right away that they're no longer contracting. So MetLife might still have them in their systems, okay? So always double check, hey, I just want to be sure I see you in our system as a contracted dentist. Can you confirm that that hasn't changed on your end? Okay, good question, good point. And then just a snapshot of the ancillary benefits basically being your life and AD&D coverage, voluntary life, short and long-term disability. You've got an employee assistance program that's embedded in the Unum coverage that you have, meaning you can get counseling services, up to 3 face-to-face visits per issue per year for each of your, you and your dependents. And then also the flexible spending account. You can see the limits there, $2,650, could possibly go up to $2,700 for 2019. Dependent care will remain the same indefinitely at $5,000. And here's a little snapshot of what those 2018-2019 monthly contributions will look like. The Blue Shield and Kaiser plans, you'll have to look at the rate page that's also posted on the benefits portal. Because your plans are set up individually rated, that means You have a rate based on your age. Your dependents have a rate based on their ages. Those rates added together will be the total premium, okay? You're only going to pay 5% of that out of your paycheck, 25% if you have dependents, okay? And then the MetLife VSP, those are pretty straightforward right there for you, okay? Cost saving tips. Tam, this was a great idea to note this. So Blue Shield has a really great tool in that it allows you to kind of estimate what your costs might be. Let's say you have to have a procedure done. You want to take a look at what different facilities around you might charge. They have a great tool on their website that allows you to compare the costs in different settings. Settings meaning, what if I get this done in a hospital versus an outpatient surgical center? You can see the difference there. Also, you can see the costs from various providers and facilities. You can also plan. It allows you to help project or foresee what your costs would be for those types of services. Likewise, MetLife, although they may not have a tool like this available, we highly recommend anytime a dentist says, hey, you know what, I recommend you getting some dental work done. You need this, you need that, you need these fillings replaced. Note to self, anything that's going to be more than, let's say, $200, I will always ask, hey, before I schedule this, if it's not emergent, can I get a predetermination submitted to my insurance company? That predetermination it's like a dummy claim. So they'll submit it to the insurance company saying, we want to do these services. Here are the diagnosis codes. Here are the procedure or treatment codes. Can you let us know, based on this person's coverage, what you'll pay out of pocket, what the employee will have to pay. So anyways, it's just a nice thing to keep in mind if ever you need to have some dental work done. Urgent care versus emergency room. Anytime you're sick and it's out, kind of outside business hours, we do recommend contacting actually Blue Shield or Kaiser. They do have 24/7 nurses available, so you can always call them, run your symptoms by them, and they can say, hey, you know what, this is probably something you need to go to the emergency room for. The nice thing about going through Blue Shield or Kaiser, contacting them, is that they can notate in their systems, yeah, we did get a call from the patient, and we did suggest that they go to the emergency room. That way, if you're ever hit with an emergency room bill, you know, you can say, hey, Blue Shield told me to go. Kaiser told me to go. Otherwise, if you're kind of questioning if it's an emergency or not, it's always hard to tell with young children. Urgent care is probably the best bet and the most cost effective. Prescriptions, generic versus brand. If you're taking a brand name prescription, know that carriers are allowed to change their formularies at any given time through the plan year. So anytime you have like maybe maintenance medication that you take on a regular basis, just double check every now and then to make sure that it's still considered covered at the tier level that you're used to, whether it be generic or brand. And if it's brand name, maybe see if there is a generic form of that medication that can help to lower your out-of-pocket costs. And then also ambulance services. You're covered, but there are ambulance services that are not contracted. The majority of ambulance services are not contracted. But if you use the ambulance for an emergent situation, there shouldn't be an issue. So just think about it twice. You know, if you're experiencing chest pain, you're thinking, gosh, is this heartburn? Is it something worse? You know, that is subject to, I would definitely call your doctor, call 911. This is probably something where you'd have to go to the emergency room. They'd probably call an ambulance for you too, okay? Thanks again for suggesting that, Tam. And then these are the extra programs and tools and resources that are available to you with the different insurance carriers. So Blue Shield, they offer identity protection. So that's something to look into. Maybe credit monitoring. A lot of people don't even know that that's something that's available. That's if you go to the Blue Shield website, if you're not registered already, I highly recommend you going there, registering as a member. logging in with a username and password, and then you can see all these tools. I always tell people just go straight to the resources or sitemap to see everything that's available to you under the Blue Shield plans. You can also view and or print a temporary copy of your ID card. You can do that from your desk. You can do that from your mobile app. So if you're going to the dentist going to the doctor after work and you don't have your insurance card with you, you forgot it at home, pull it up on your app from your phone. You can also take advantage of certain discounts, like through 24-Hour Fitness, for instance. There's participating gyms that will offer discounted membership for Blue Shield employees. So you can go onto that site and take a look and see what 24-Hour Fitness near you will provide those discounts. Okay, discounts for Weight Watchers. Lots of good stuff. Continuing with Blue Shield, chronic condition management. If you need to get some additional help with maybe your claims, you can always contact Blue Shield, ask to get in touch with their chronic condition management department to have somebody help oversee your situation and direct you according to your care, based on, of course, your doctor's recommendation. Life referrals 24/7. You can get kind of like an EAP type of thing. So not only can you get assistance with personal issues, financial issues, but there's also, like I said, the identity theft assistance. And then, as I mentioned, the 24/7 nurse help line. If you're unsure about the symptoms that you might be having, you want to know if you need to go be seen right away, emergency room. This is a great resource. For me, a couple of years ago on my insurance, I was having pain during work. And I thought it was I couldn't tell what it was actually. Went home, thought I'd take a nap. Woke up, I couldn't move. I called the 24-hour nurse line for my insurance, and she goes, "It sounds like classic appendicitis. You need to go to the emergency room." I'm like, "Yeah, right, appendicitis. Who gets their appendix out anymore?" Well, guess what? I got my appendix out that day. So it's nice to know, because I just didn't know, is this something that's going to pass over time, or do I just need to get seen? Kaiser has similar products and resources. They also have a mobile app that allows you to do a lot. You can schedule appointments, refill your prescriptions. They have healthy resources. They've got, as you probably know if you're a Kaiser member, they have excellent health classes on their locations. So definitely look into your local Kaiser and see what's available to you in terms of classes. You can also partner with a wellness coach, manage your weight, reduce stress, increase activity, quit smoking. They also offer fitness club membership as well, chiropractic care, acupuncture, 24-hour nurse line as well.
And Christy, I'm sorry to interrupt. We
Sure.
have a couple people on the phone. Hopefully you guys realize now you're unmuted for now. But there are people who are not in California. So Christy, if you can just walk through what plans
Sure.
are eligible.
So Kaiser is a California facility, and it's an offering here for the California employees as another HMO option. For those of you outside of California, you would have the option of the Blue Shield HMO and PPO plans. Okay. VSP, they also have available resources and tools. You can get discounts on different supplies, such as contact lenses, additional frames. You can also get your vision care done at a participating facility, eye care facility that contracts with VSP or participates with VSP. It would just be a $20 copay. Plus, members automatically get an extra $20 to spend on different brand name frames like Calvin Klein, Anne Klein, Nike. Those are available too. You would just need to check VSP for participating providers that would have those brands available. Similar things here. You get your, actually this is actually a lot of fun, a convenient option. The Iconic or VSP eyewear store, it's the only site where employees can go and buy their eyewear. they can also view what their eyewear looks like on them. So you can kind of get a sense of that, play around with different styles and frames. And something else VSP offers is a member discount program through True Hearing. So if anybody has hearing aids, hard of hearing, and you want to look into discounts, you can get a nice little discount of 50% when you go through VSP's True Hearing Member Plus discount program. And that, my friends, is your open enrollment presentation. Are there any questions that I can help you with?
And let me
Sure.
go ahead and unmute the people on the call so that they can open it up for questions as well. So everyone will be unmuted, but if you do have background noise, I do ask, just out of courtesy, if you guys can mute yourself back on. But feel free to speak up. We also have people in the conference room, so if there's interlap, we're going to call names.
Yeah, I have a question on chiropractic. I saw one of the slides where it was mentioned that Kaiser offers chiropractic. So is it that always the primary doctor has to recommend you for the chiropractic, or shall we just walk to one of the chiropractic center outside of Kaiser? And how is the coverage for this? Is it separate if we go to the Kaiser chiropractic based on the doctor's recommendation, or is it the same?
As long as you go through the Kaiser participating provider, you can self-refer to a chiropractor. So you would go to the Kaiser website, kp.org.
Mm-hmm.
You would go to Choose Healthy. You can see there that it would be a 25% off, and that's a point of service discount. So there shouldn't be anything that's billed to your insurance company. Basically, when you go to that site and you look for a participating chiropractor or acupuncturist,
Mm-hmm.
you would go there, you would tell them, hey, I'm a Kaiser member. You would show them your Kaiser card. You would mention to them, I understand that you are a participating provider with Kaiser, and it would be at that point that they would discount you at 25%, and you would just pay for your service right then and there. You don't have to fuss with claims. But you're right, you do not have to go based on a referral from your primary care Kaiser physician.
Okay, got it. Thank you.
You're welcome. Great questions. Anybody else? I mean, same thing that you've always had, same medical carriers, dental carriers, vision carriers. But yeah, if you have any questions, the benefits portal has been updated with a lot of the new information and documents that can help you make that decision. Tam is available. I'm available. Just don't hesitate to reach out.
This is more of a comment less than a question. So obviously, if you aren't making any changes and if the out-of-pocket max has changed because you've enrolled into any of the plans, Kaiser or HMO PPO, then new cards should be sent to you. But a reminder, dental cards, I believe you receive from MetLife. I'll check to see if you get new cards. If nothing has changed, Christy, if we can check on that. But VSP doesn't have cards. So
and MetLife doesn't have cards either. They don't send out cards, but you're always welcome to go to their website and just print out a generic card and provide that to your dentist. Most dentists know how to get in contact with all the dental providers if they need to verify benefits or anything or eligibility. Okay. Great.
All right.
Everyone, thanks so much for your time. Again, open enrollment starts today. It ends November 20th. Thank you. My name is Christine, and yeah, we'll look forward to hearing from you if you have any questions.
For those on the call, if you guys need to make any changes or enroll into a different plan, let me know. I'll send a electronic form version so you don't have to fill out a physical form unless you want to download and send it to me. And those of you here, you notice I put some forms out for you guys out of convenience. So thank you again, everyone. I'm going to actually end the meeting now, but if you have questions, please send my way. Thank you.
Thank you.
Thank you.
I'm gonna give it that white.